warning signs of cervical cancer you should not ignore. Cervical cancer is a deadly disease that kills hundreds of thousands of women worldwide each year. According to the World Health Organization, about 600,000 new women are diagnosed with cervical cancer and about 340,000 die each year. To know the signs of cervical cancer is very important to your survival. In this video, we are going to share with you 8 warning signs of cervical cancer that you should watch out for to save your life. Watch now to learn more. In United States, about 14,000 new cases of cervical cancer and 4,000 cervical cancer-related deaths occur each year. But due to routine interventions such as screening programs and HPV vaccination, there has been a continuous downtrend in the incidence and deaths of cervical cancer with each passing year. Unfortunately, the story is different in developing countries. Cervical cancer starts in the cell of the cervix, which is located on the lower end of the uterus at the junction of the vagina, and usually develops slowly. Before cancer appears, the cells of the cervix go through changes known as dysplasia, in which abnormal cells begin growing in the cervical tissue. If not destroyed or removed, the abnormal cells may become cancerous and spread more deeply in the cervix and to the surrounding areas. Women who are diagnosed early with cervical cancer have a high chance of surviving than those who find out too late. Therefore, women need to have regular screenings, get vaccinated against HPV, and know the signs and symptoms so that they will be able to catch it at early stages. Unfortunately, early on, cervical cancer usually doesn't have symptoms, making it hard to detect. When symptoms of early stage cervical cancer do occur, they may include 1. Abnormal vaginal bleeding. One of the most common and early signs of cervical cancer is abnormal vaginal bleeding. This can include vaginal bleeding after intercourse, which becomes frequent over time, vaginal bleeding after menopause, vaginal bleeding between periods or periods that are heavier or longer than normal, and bleeding after pelvic exam. 2. Vaginal discharge. This is another early sign of cervical cancer. In early stages, the discharge is watery and foul-smelling, but as the disease progresses, it becomes red or brown in color. 3. Pelvic pain or pain during intercourse. Having unexplained pelvic pain is one of the most probable signs of cervical cancer, and this is because of cancer affecting local nerves. Also, women may experience pain and discomfort during sex. This is due to extension of cervical cancer into the vagina. The next 5 signs are mostly seen with advanced cervical cancer, which means this cancer has spread beyond the cervix to other parts of the body. 4. Difficult or painful bowel movements. Having difficult or painful bowel movements is a sign of advanced cervical cancer. This is due to cancer growing and compressing on large intestines, causing constipation, and in some cases, bowel obstruction. 5. Difficult, burning, or painful urination or blood in the urine. Burning, painful urination, or blood in the urine is a sign that cervical cancer has spread to the bladder or urethra. Also, cancer compressing the surrounding structures such as the urethra and bladder can lead to difficult or complete inability to urinate. 6. Lower back pain. Pain connected to your back can be a sign of a lot of different health problems because lower back is linked to many of the internal organs. But constant pain around your lower back area can be one of the signs of cervical cancer. 7. Leg pain and swelling. As the cancer grows and becomes more advanced, it may start to press against nerves in the pelvic wall and the lymphatic system, resulting in leg pain and sometimes swelling. While swelling could be a symptom of several medical problems, if accompanied by leg pain, this could be a warning sign of cervical cancer. 8. Loss of appetite or unexplained weight loss. As with multiple other forms of cancer, unexplained weight loss or loss of appetite is an indication of cervical cancer. Cancer causes the body to burn more calories than usual, break down muscle protein, and decrease appetite. And even if your appetite is not affected, regardless of how much food you consume, weight loss continues. This is often a sign of cervical cancer in its advanced stage. These signs and symptoms may be caused by many conditions other than cervical cancer, and it is always better to have a proper checkup before assuming the worst. Just keep in mind, the only way to know is to see a healthcare professional. If it is cervical cancer, ignoring symptoms may allow the cancer to grow to a more advanced stage and lower your chance for successful treatment. Thank you for watching. If you liked the video, please share with your friends and subscribe to our channel if you haven't already done so. Until next time, stay healthy and remember, health is the greatest wealth.